Hey guys, so we are back and we're going to go over Module 8, the third part of it. It's just a few slides, and then I'm going to go over your top 200 drug list and kind of how that's going to work. Okay, so this is going to be our final week before I go on maternity leave. So I want to get you guys set up really good with Miss Walsh, and hopefully you kind of know what to expect when she takes over the class, because it's going to be a little different. It's going to be in a new Google Classroom, so hopefully you can, or you have already switched over to that, but we will start it the week that she takes over, which is February the 8th. Okay, so, and that's assuming I don't have the baby by then. Okay, I'm going to present my screen. So we can see the lecture here. Okay, and I did module 8 in these different parts because it is so long and a lot of information. So I want to kind of break it up into 2 weeks here. We did part 1 and 2 last week. If you didn't watch that, you need to go watch that and then watch this. Okay, so module 8, part 3. So the first thing we're going to talk about is patient information when filling. So you're always going to verify the spelling of a patient's name and address. Next, verify the prescriber's name, verify the patient's date of birth, and document it on the prescription. If medication is liquid and a pediatric patient, ask for the patient's weight to make sure that the dose is correct for the weight of that child. I don't know if y'all remember from Module 6, but part of the math, they talk about the way that they can decide, or how they decide how much a child should get of a adult drug. You know, something like amoxicillin, which is a pretty common antibiotic that they make into a liquid for kids, right? So, but kids can weigh all different weights. So they go by Clark's rule, and that is a test question that they will ask you about dosaging for children. And Clark's rule is the most accurate, okay, because it goes by weight. Look for anything suspicious about the prescription. For example, tablets being prescribed for a child or a baby, that would be a little bit suspicious, okay? All right, delivery of prescription or prescription pickup. So verify the number of prescriptions being picked up. Verify the demographic information like phone number, address, date of birth, especially for common names. Check the prescription. Always double check at the end to make sure it's actually for that patient. Check the receipt for any third-party notations like insurance. Collect the copay if there is one for the medication. Inform patients of counseling available by the pharmacist and process the sale. So you probably have seen this in the pharmacy, how this all goes, because you guys have all been there at this point. So this probably isn't news to you, but it's just a reminder. Potential medication errors, even with the best systems in place, errors can still occur. Oh, sorry, guys. Oh, it's early. Usually I've been trying not to make my videos this early, but sorry. I had to get it done this morning. So errors do happen, and there's a couple of things to help with that, but we talked about that in part 1 and 2. A root cause analysis is the process of investigating an error to determine the cause in order to prevent it from occurring again. Risk management teams are specifically trained to do this. This you probably won't see in the pharmacy very much, but it was like a key term they wanted you to know. Continuous quality improvement is another key term they wanted you to know, and it's the process of meeting regularly to identify, review, and promote safe medication use. These meetings are usually held monthly with key members of the pharmacy staff. This is kind of only relevant if you work in like a hospital, a larger pharmacy, or you are in management at that pharmacy. Okay, and then communication. Don't say things about errors in front of patients to pharmacists. Since this will spark panic, simply tell them, I have an important matter to discuss with you, or have another phrase decided upon. You don't want to freak the patients out. Okay, documentation. So document errors per employer policy, most employers voluntarily report near misses and errors to medication authorities. The ISMP medication reporting program, or MERP, if an error happens in the pharmacy, and that is a test question, they're going to want you to know the MERP. The MERP is for pharmacy errors. Vaccine errors is VERP, if an issue or adverse reaction happens from a vaccine, either in your care at the pharmacy or if a patient comes in and they have had a adverse reaction. And then FDA MedWatch is well known by consumers as well as pharmacy staff, and adverse reactions noted by consumers or pharmacy staff, you can also report to them. Work environment, read about workflow. That's in the module. I don't know which page in the module it is. This is for the gray book, but it's just kind of goes through workflow. It's too much to kind of summarize, so make sure you go through that in the module. Sulfa drugs and penicillin. I've hit on this a couple times, but it's very important that you know this. So along with penicillin, sulfa has the next highest risk for adverse reactions in its medication class. So they are both antibiotics, different kinds of antibiotics, but they have a very high risk for allergic reactions. I can't remember the percentage, but it's a pretty high percentage of the population has one of these two allergies. So it's a very common allergy, and that is why you never put sulfa or penicillin drugs in the ADS machines. Always clean any counting trays used with these drugs due to cross-contamination, and don't use in automated counting machines like the cell. So remember that. That's a very important thing, and they do ask that on the certification test as well. Okay, cleaning and organizing. Work areas should be cleaned in community retail pharmacy at the beginning, middle, and end of each shift. Counting trays should be cleaned with 70% isopropyl alcohol at the beginning of each shift, during the shift, and after counting penicillin or sulfa drugs. Now, if you are doing sterile compounding, remember that is a little bit different and requires more cleaning and more sterilizing. Outdated medications, refrigeration, and crash carts. So outdated medications, you need to remove from the shelf monthly and return to the manufacturer. There is a question on the practice test that asks about outdated medications, like what do you do with them? And you're going to return them to the manufacturer. Perpetual inventory is an exact record of inventory at any given time by adding all orders received and removed every order dispensed from inventory in real time. When you remove a medication off the shelf due to being outdated, you must document it in the perpetual inventory log. Refrigeration or refrigerated and frozen meds, thermometer needs to be checked daily and logged to ensure proper temperature. And crash cart, these are carts full of emergency medications used during a code, like in the hospital, that are stored on nursing unit floors for easy access. In hospital settings, nursing units are inspected monthly to ensure medications are stored properly and in a secure area. All right, so that's it. That's not a whole lot, you guys. I'm going to go ahead and close out of this. And then, so we have finished all of our modules. So now what's next is you guys learning the top 200 drugs. So let me just give you like a little, I guess, a peek into what we're going to be doing into the new Google Classroom. It looks a little different on mine because it shows everything on mine, but on y'all's it probably doesn't show all this stuff yet. But each week, I've labeled the weeks now. You're going to go over a section of your top 200 drug list. I gave you a paper copy of this when y'all came to pick it up, but I'm going to put this at the top so you can download it. And it has, if you would rather fill it in this way where you type it in, then go ahead and do that. But it doesn't look like this when you open it. It's kind of got a little messed up areas, but that is your top 200 drug list. I've updated this for the 2020-2021 year. So these are drugs that some of them are over the counter, some are prescription, and most of them are by they are classified by the body system that they treat, except for things like pain management, because that can treat all of the body, but things like respiratory, allergies, asthma, musculoskeletal, joints, gastrointestinal, like your stomach. So, and each week you're going to be responsible for a list. Okay. So, for example, this first week that you guys have Miss Walsh, February 8th through the 12th, I've got lesson plans for her, which she probably won't post, so you probably won't see that. And then the video lecture for pain management, which will be available for you to see. And it's another YouTube video, and it's me going through the PowerPoint. And then here's the PowerPoint. You can go along with it. And I would highly suggest you guys watching these because they're not that long, and they're just helpful because what I go over not only the drugs, but their functions, the medication classes. I just go in more in depth, and it helps you to understand these drugs and how they work, and also can give you some tips on how to memorize them. So the lectures are really important. Okay, and then you're going to have some review questions every week. So some of them, like some weeks, like this first week, you're going to have like 15. These come directly off of the practice tests. I just went through and picked some questions that I felt like went with that week's drugs. So sometimes they don't really look like they go like fully for pain management drugs, but like some of these are like controlled drug questions and stuff like that. So, and then Miss Walsh will go over them the following week with you. So I have the answer key for her here, and she'll go over them with you that next week after you turn them in. And then you're going to have a quiz due every Friday. I'm not sure how she's going to like put these out for you guys, if she's just going to open it up at the beginning of the week or what. I'll have to talk to her about that. But it will be available, and you can take it, and it's a Google form. It will be due that Friday every week. So it's not a whole lot of stuff, you guys. I feel like I haven't given you guys like more than you can handle. In fact, I feel like it's a lot less work than we have done in the past, because once a week you are going on your externship, and you're learning a lot there. But you really do need to memorize and learn these drugs and know them well. So, and then as we go through, you're going to have that pretty much every week. Some weeks you don't have review questions. The week we do musculoskeletal and eye, there just wasn't any good review questions for that. So you just have a quiz to go through for that. The quizzes all are 10 questions. And but then like we pick back up on review for this week. And then that's what we're going to do the first 10 weeks that I'm out. And then we're going to start reviewing for your certification test. I'm going to show you how to sign up for the certification test, give you a test bank to go through and look through. Well, you're going to do the test bank questions, and it's kind of like a review, but my kids have always said that it's been really helpful to them. So it's that's going to be kind of the thing that we do the last 12 weeks of school. I'm going to go back to this here. Okay. Stop presenting. Okay, guys. So hopefully this was helpful for y'all. And it looks like my face might be frozen. I don't know. Hopefully you can still hear this, but I'm going to stop this now. Hope you guys have a great day, and I will talk to you later. Bye.